Okay, good morning, everyone. Let's do a quick testing. Can you hear me through the webinar? Testing, 1, 2, 3. Testing, 1, 2, 3. Are we good? Perfect. Good morning, everyone. As you can tell, things are a little bit different here in the Lotus webinar room. Today we're using Zoom and we're going to see how this platform runs from Adobe, and we'll see which one works better for our audience. So thank you for joining today. My name is Donna and I will be your host and your moderator for today's event. Today's webinar is recorded and presented by Lotus Institute of Integrative Medicine. Here at eLotus, we have been holding educational courses for over 2 decades, and we are proud to be your trusted source for premium CEU content. On behalf of eLotus, I want to thank you so much for being here today and choosing eLotus as your CEU provider. Out of curiosity, how many of you are new to Jimmy's class? If you're new, go ahead and type new into the chat room. Okay, looks like we do have a few people here today. Thank you so much for joining, and I hope you enjoyed today's class. Jimmy is a fantastic speaker, and you'll see why. So let me tell you about him from someone who has been there since the beginning of his eLotus journey. Jimmy is the type of presenter that wants to help you succeed in the easiest, simplest, most efficient way possible. He breaks down what someone may think is a difficult concept like pulse reading, and you'll see this in today's class, into a super easy way of understanding. So if you've been avoiding pulse reading in school because the concepts were just too all over the place, you're going to love his class today. If you're looking to cut the BS and just get to the best cliff notes to thrive in your practice, you've come to the right webinar. Today's class is on acupuncture and herbs for migraines, tremors, and insomnia, part 1 with Jimmy Yan. He'll be sharing how to produce results with neurological conditions. And today we have 3 groups with us. The first group is our Watch It free group. You registered for today's webinar using a coupon code, and this allowed you to gain access to today's live webinar event. Now, if you would like to earn CEUs or get the 2 4-week access of the video replay, you can upgrade to our second group. Our second group is our paid group. Cheese. Paid attendees receive CEU credit and can rewatch the contents of today's class for as many times as they like for a whole month. So you get the video replays and you get to earn CEUs for today's class. And finally, our last group, the third one, is our Gold Pass members. Gold Pass members have unlimited access to all of our online courses, and that's over 3,000 hours of videos, and it includes live webinars like today's class. So you don't have to pay again. It's your golden ticket to all of our online courses. Gold Pass members can access any of our English courses for as long as you are a member. Plus, you also receive special perks from our industry sponsors. So I'd like to take this time also to thank our sponsor, Evergreen Herbs, as well as their customers. When you choose Evergreen as your herb provider, you're also choosing to invest in the advancement of TCM and provide opportunities like today's, in which you and your colleagues can attend free educational courses that will fine-tune your skills. So thank you so much for your support. Now, before we begin, I would also like to cover a few housekeeping topics. Today's webinar will run from 9 a.m. to 6 p.m. We'll have a 1-hour lunch break from 1 to 2 p.m. and there'll also be short breaks throughout the class. And Jimmy will let you know when those breaks are. And what you'll see on your screen, you should see the video pod to the right of the screen and the PowerPoint to your left. And to receive credit for those who are paid or Gold Pass, you do need to be logged in all day. And once again, our paid and Gold Pass members get that 4-week access. All right, let's get started with today's class on producing results with neurological conditions. Today's class is part 1. Tomorrow we will continue with part 2 since there's too much information to fit in just one day. Jimmy Yan is a seasoned acupuncturist and herbalist with over 10 years of experience. He started his private practice, Achieve Integrative Health, in 2007 and built it into one of the largest acupuncture clinics in the Austin metro area, where they are focused on quick, effective, and long results. So without further ado, let's go ahead and welcome Jimmy. And Jimmy, if you can go ahead and also share your screen so we can see your PowerPoint from your end.
Okay, cool. I'm gonna do something different. I found an option that I can share it through my iPad Pro, so hopefully it works. Let's give it a try. Let's see. Here. Mirroring. 1 second.
Perfect. I see it coming up.
All right, can you see it?
Yep, we're all good. Let's
Awesome.
roll.
Okay, perfect. All right, so I'm doing something new today with technology, so if there's a glitch, I apologize in advance. So for those of y'all who do not know, who have not heard of me, that is my responsibility. I apologize for that. So I do things a little different, as Donna has already said. And so we're going to start off by, I'm going to introduce myself a little more as to why you should be listening to me and why should you know, what I have to share is actually useful. I only spend about 5 minutes of that. And then I'm going to go right deep into the most important part of this weekend. Yes, I'm going to share that first. I'm not going to wait till the end. I'm going to share it first. So let me see if I can move my slide. It's not moving. Sorry, 1 second. Nope. There you go. There you go. So for those of y'all who are on the Wednesday preview, I'm going to repeat some of the stuff that I said because some people are new to today. So my purpose and goal is to help you succeed as an acupuncturist. That's the whole purpose of me doing these webinars for eLotus. It's not to spread my name. It's really to help and elevate our profession. So what I'm going to help you do is to be able to communicate with patients about no, I still didn't change the slide, about neurological disorders and produce results 10 years from now. I hate going to seminars where it takes me forever. I got to study for months before I can actually produce results. That's not the case with my systems and my treatments. If you implement exactly the way I say, you will be able to produce results on Monday. Okay. And my focus is also on this third thing, help you be able to help thousands of people get 70 to 80% improvement instead of just helping one person get 100% improvement, okay? So that's just my focus. I'm not saying this is right or wrong. This is just how I do things in my clinic and how I built one of the largest practices in Austin, Texas. I focus on the masses. I want to help more people, even if it's not 100%, but I want to help more people achieve 70 to 80% instead of just try to spend all my time on trying to get 100% for one person, okay? Next, so why should you listen to me? This is very important because whenever you're listening to any type of webinar, you want to do your due diligence as to why you should be listening to the speaker, right? So do I have the credentials? Do I have the, not credentials, do I have the facts to back up what I'm about to teach this weekend? So I'm the go-to acupuncturist for Austin's top neurologists. So majority of Austin's neurologists, they refer patients to me. If I'm speaking, I speak really fast. So if I speak too fast, just tell me to slow down, okay? My clinic is also the rotation clinic for physicians and physician assistants. So they come into my clinic and learn acupuncture from me. I've trained with some of the top neurologists. One of the top neurologists is in this picture below, and that is Dr. David Kornblath. He is a neurologist at the Johns Hopkins Hospital, which is the number 2 rated hospital for neurology in the whole US. I'm also a member of the medical advisory committee for the Neuropathy Alliance of Texas. That's a nonprofit organization for neuropathy. And they have a medical advisory committee, and I am the only acupuncturist on that committee, along with 4 other of Austin's top neurologists. I was asked to be on this because of the skills, because of the results that I produce. One of their members was a patient of mine and introduced me. But if you want to know more, you can always ask. I've written a couple of books. This first one is Achieve a Life Free of Neuropathy. This is one of my very first books, but 100% disclaimer and transparency here. I did not write this book myself. Most of it, I would say 90% of it was written by a ghostwriter, and I wrote 10% of it, okay? This book, I actually wrote myself. It's called Achieve a Life of Wellness. This is kind of the roadmap, is the starting point for anybody with any type of disorders. And this can be applied for today's people with neurological disorders. It sets the foundation that people need to do and people need to think about when they're trying to reverse their neurological conditions. So this is a book that is 100% me. All right, so here's the real reason why you should listen to me. Because, it's not about who I studied with. It doesn't matter who I study with. I'll tell you who I study with, but it doesn't matter. It doesn't matter where I study. If I don't produce results, it doesn't matter. Everything I say to you right now is a bunch of BS then. So here's the reason why you should listen to me. Pre-COVID, my clinic was seeing 168 patients per week. And this is in one clinic. Okay. Now, obviously, COVID hit and our numbers dropped. It actually dropped quite a bit. We dropped down to 58 patient visits per week. And just now, this past week, we're back up to 120. But we see a ton of people. We help a ton of people. And so my experience is not through what I learned from other people. My experience is actually what I learned from my patients, because we treat a shit ton of people. And so therefore I have the experience, I have the proof, I have the results, which I will share with you this weekend. I'll share some videos of some of our patients for these neurological disorders. Okay. That's the whole point, is letting you know that, hey, whatever I'm going to be teaching you, it ain't from the book. It's from my clinic. It's from the school of hard knocks. Okay. So pay attention. All right. Enough about me. Well, a little bit more about me. Sorry. My sharing style. So you're either going to love the way I share or you're going to hate the way I share. Okay. I do not, make things complicated. I try to make things as simple as possible. And so a couple of things that people, the negative feedbacks that I get from my past webinars with eLotus is, number one, my system's way too simple. Because it's so simple, they think it's too elementary and therefore they don't implement it. Okay. And we get the complaints about, oh, he could have done the 2-day seminar and webinar in just one day. Yeah, I could actually do it in 1 hour. Okay. But there's one big hurdle that's stopping a lot of y'all from learning it. And I'm going to address that after this. So another one, I'm too simple. I don't use technical terms. I don't present a lot of research, like, on PubMed research. I don't do all that stuff. Mine is practicality. Mine is results-based, not evidence-based, not research-based. That's how I get my results, and that's how we help a ton of people, okay? So my focus in my clinic is to help 1 million people make pain and suffering optional. It's not to become the most educated acupuncturist. I don't want all the million credentials behind my name. I'd rather help 1 million people. And if that is your goal, then you're in the right place. If that's not your goal, you're gonna hate this weekend, okay? And some of you may be thinking, why am I on this webinar, okay? I'm pretty sure if you don't want to continue this webinar right now, you can contact Donna and she'll gladly refund you. But I think some of this is for free, right? Next, I'm not going to teach you everything you need to know about neurological disorders. It's kind of counterintuitive, right? You're learning that's the topic, is learning neurological disorders with me. But I'm not going to teach you everything you need to know, because a lot of stuff you can go on Google, okay? I'm not gonna just read from Google and tell you. Remember, none of this is theoretical. Everything I'm gonna teach you is what I do in my clinic every single day. Some of the patients that I'm gonna share with you this weekend are like, I've treated them 6 times. And so I'm gonna share with you stuff we're doing right now, not necessarily 13 years ago when I first started, okay? Like I said, so I'm going to show you how to get phenomenal results now and not 10 years later or 10 certification courses later. You're not going to have to take certification courses after this. If you just follow, if you really open your mind and follow what I'm saying, you're going to get great results. Okay. So my systems are based off of 100% transparency. You can ask me anything, okay? And I won't withhold information. I hate it when people are teaching and they withhold information. You know, so I'm doing everything that I hate. I'm going to do the opposite of everything that I hate about, you know, when I'm attending a webinar, right? So again, I'm results-based, not evidence-based. One acupuncturist asked me that, what's the difference? There is a huge difference between results-based and evidence-based. Evidence-based is basically, you know, you can read this definition according to your Wikipedia, is the idea that occupational practices ought to be based on scientific evidence, okay? Now I'm slowing down here because this is very important. If you can shift your mindset into this, then you'll start getting great results. If you're focused on evidence-based, you're not gonna get that great results that quickly. Evidence-based is they do research, but research has to be in a controlled study. There's so many variables, you can't control everything. And if you're based on evidence, look at medications. Medications are evidence-based practice, right? And we all know medication doesn't work, but it's evidence-based. So if you're doing based on that theory, then hey, you're going to get the same results as medications. Instead, I focus on results-based cases I've personally produced, not from what I didn't hear it from someone else. I didn't hear the result from someone else. I personally produced the results I'm going to go over this weekend. So that's, again, I'm not saying what's right or wrong. I'm just saying my focus is on results, not on evidence. Okay. Number 3, I simplify and I cut the fat. I am getting straight to the point. It may not seem like I'm not getting straight to the point, but everything that I say is vitally important. I don't like to, personally, on a personal level, I don't like to talk. You can ask my wife. When I go home, I don't talk. I do not like talking. So talking for this whole weekend is something, you know, out of my comfort zone. But so therefore, I'm going to save words. I'm going to only use words. I'm not going to use unnecessary words. And also a reproducible system. What I'm going to teach you is something that is reproducible. It's not just a system. System can work in only, you know, everybody has different systems, but sometimes they only work in certain conditions. You have to be certain conditions. You have to have 20 years of experience in order for it to work. That's not mine. Mine is a reproducible system where if you just implement what I teach you this weekend, you will be able, as is, don't mess it up. Don't, you know, put your own twist into it. Do it as is. Guarantee you'll get results. I know this not from theory because I have associates. Every new associate that comes into my practice within the first week, they have to learn other things. But after learning my acupuncture system, actually in one day they can start treating and produce results. So my systems are reproducible because my associates, every new associate that I have brought on and learned my system, they're producing results instantly. Number 4, I do things the opposite of the norm of the TCM practice. That's how I built my practice. That's how we help a lot of people and get great results. So another thing that people hate about me, about when I present, is I answer questions. I answer everybody's questions. But here's the thing, I'm not going to waste your time with info that you can get from Google. Okay. All right. So most important part of this webinar. Okay, hold on. I think I'm missing some slides. I'm gonna see if I can pull this up. So 1 second, guys. Come on. There we go. Okay, so the most important part of this webinar is right now, okay? So if you want to take, if you're not taking notes, you better take notes. And many of you are going to think, oh, okay, I know this stuff. You know, I don't need to work on this. Just show me the points. Show me the acupuncture. And that's why some of y'all who logged on early, you saw me right. Can y'all see my whiteboard? Can y'all see my whiteboard? Can you text in the chat? No, not really. Okay, let me see if I can go here. Can you see it now? Okay, never mind. I'll read it. So in this back, basically I wrote the question, what points and what herbs? And under both questions, I put all work. So I'm going to answer all of y'all, some of y'all who are thinking, what points does he use? What herbs does he use? I'm going to tell you the answer right now. Everything works. If you are on this webinar to learn what points to use, what herbs to use, then this is not the webinar. I'm sorry to disappoint you. There's no magic points. There's no magic herbs because they all work. So they all work. Okay. So hopefully that will solve that question. All right, let's get back to the most important part of this webinar that I'm doing right now. The first part of this webinar is a secret that most acupuncturists ignore. The secret is the system of decision-making. Decision-making is the most important part of getting great results for neurological disorders. Actually, just in any disorder, whatever you treat, okay? Many acus want to know the points, the herbs, the supplements, the tools, but these are not important. I'm telling you, I get great results with neurological disorders, and these are not important. I'm going to go over some of them, but they're not important. It's the system, the decision-making on how I find which points to use. That's the importance. In fact, I'm going to tell you, I don't even use points. I don't use acupuncture points, okay? So then, Confucius once said, give a man a fish and you feed them for a day. But if you teach them to fish, then they'll eat for a lifetime, right? So that is my goal for this webinar, is to teach you how to make that decision, how to make the decision on, do they need acupuncture? Do they need herbs? Do they need supplements? Do they need other like whole body vibration? Do they need anodyne? Do they need rebuilder? Do they need any of these other, tools, shiny objects, right? That's what I'm going to teach you. And if you pay real good, close attention right now, I know some of y'all are already phasing out and it's like, this stuff is not important. Get this. There's one person that asked me on Wednesday, just get to it. Let's get to it. I am getting to it. And if you don't think if you are not comprehending that this is the most important part, then this weekend is going to be a waste for you. Okay. Now, with every patient you are presented a fork in the road. So you have a fork in the road and you need to decide which direction you want to take, right? That's the decision making. So what good is it going to do if, let's say, you're driving a car and you come to this intersection and you've got this fork in the road? You can go to the right side, you can go to the left side. What good is it? What good is it going to do you if you are in one of the roads and you have a car, but you're driving the wrong path? Right? You can go super fast versus someone who's walking, but they choose the right path. They'll reach their destination faster than the person who's in a car who's on the wrong path. Some can say this is TCM diagnosis. Okay, so like TCM diagnosis, it's a decision making. So if you don't come up with the right diagnosis, you're going to be like the car driving in the wrong road. Okay, so if I can emphasize, this is the most important part. It's the decision making, not the points, not the herbs. Okay, the decision making. If any of y'all, I know I have a slide later about this, but I'm going to tell you now. If you have a question, there's a Q&A box at the bottom. Type your questions in that Q&A box. Okay, don't put it in the chat because the chat's like scrolling like crazy and I can't, read the questions. But if you can click on the Q&A chat and type your questions in there. If you don't know where that is, contact Donna or Sam and they'll tell you where to do that. Okay. All right. So the number one thing, mindset is the number one to treatment success. To produce phenomenal results, I found that being 100% transparent with your patients is vital. I'm 100% transparent with everybody. That's why if you ask me a question, I'll answer it, Okay, but let's try to keep the questions to the topic that I'm talking on right now. If you have additional other questions, I'll answer them either at the end of the session or at the break. I'll look at it and so forth. But I will answer all of your questions. Okay, so number one is being transparent with your patients. Number two is keeping an open mind so that you can listen. So if you think mindset is a bunch of I don't know, like woo-woo stuff, and you just want the acupuncture points and you just want me to keep on talking about the herbs, you're missing the point. Okay, and you're not going to be able to use my system to get great results. The third thing, focus on your patient, not yourselves, not ourselves. This is crucial. Too many times we want to do evidence-based. We want to go research and say, oh, this so-and-so source says that this point will work. This herb, this supplement will work, right? Or you want to go study and, to get, letters behind your name. That doesn't help the patient. What helps the patient is you're focused on the patient. What does the patient want, right? That's the number one thing. So I'm taking some time for this because if you don't do these three things, then it doesn't matter what I share with you, the acupuncture points, the herbs, the supplements, none of it will work. You have to be transparent with your patients. You have to keep an open mind. Oh, I can mark on this. You have to keep an open mind, and you got to focus on your patients and not yourselves, okay? Questions to guide you to success. So number one, these are things that you need to ask yourself every time that you remember decision making. These are the questions. Will it help your patient achieve their goals? Okay. So what is, when we're treating patients, what do you think is the goal? What do you think the patient's goals are? Okay, type these in the chat. I want to see if y'all know this. What do you think your patients want when they come to your clinic for neurological conditions? To feel better? Yes. Can you be more specific? Pain relief? Yes. Let's see, to get better, to be out of pain? Yes. More vitality, functional. What does functional relief mean, Joyce? Better quality of life? Yes. These are right. Quality, better, exactly. So they want an improvement in their quality of life. They don't necessarily, they're not caring about the pain, really. It's not the pain, the tingling, the numbness, the tremors that we're going to go over, the Bell's palsy, right? They're not concerned about those things. They come to us because what I call their life effect, their migraines, okay, their neuropathy, they are affecting some part of their quality of life. And that's what they're concerned about. They're not concerned about the neuropathy. They're concerned about their quality of life. And this is what I mean by focusing, helping them achieve their goal, because we can not 100% eliminate their peripheral neuropathy, but we will still have success because we got them to be able to go back on the golf course. That's a success. And that's how I classify it as success. I classify that as success because that's what the patients want. It's not what I want. I mean, I want to eliminate the neuropathy, but this is not about me. When we're treating patients, it is never about us. It's about what the patients want. And the patients, if you don't even ask the patients what they want, how will you know, right? So number two, when you're trying to decide do I change my acupuncture points? Do I change the herbs? Do I add supplements? Do I add functional medicine? Do I add all these, tools? The second question you need to think about is right here. Will it change your treatment? Actually, that question is, will it change the outcome of the treatment, I would say, right? So whatever you do, will it change your treatment process? So actually a better analogy is this, a better example is this, like orthopedic exams, neuro exams. I do some neuro exams, but I don't do all of them. Why? Because they don't change my treatment. And another thing about diagnosis. So I had a patient who came in for essential tremors and then recently got diagnosed with Parkinson's. Does that really matter to me in regards to treatment? No, it doesn't. Okay? It doesn't change my treatment. So, but it helps, I mean, it gives the patients a peace of mind that they got labeled, okay? But it doesn't change my treatments. So these are the things you gotta pay attention to. And last, number 3, will it provide more clarity for your patient? So if you're gonna say something, if you're gonna provide research, some data for your patients, is it going to provide clarity for your patient, or is it going to confuse them even more? So you'll notice, as even up to now and even later, today, I don't use complicated words. Like the way that I'm talking to you is the exact way that I talk to my patients. I do not use complicated words. I do not use Chinese medicine terms. I do not even use complicated Western medicine terms. I explain everything in layman's terms, okay? So these are the 3 questions that I'm gonna constantly remind you to be thinking about when I'm going through this, okay? So I have a question right here. Linda, how do you treat sternal excruciating pain that causes the patient to consider suicide? I have not seen this patient yet. So Linda, I will gladly answer your question. Let's do it later on, okay? Because I want to stay on topic. So how do you learn quickly? You need to commit yourself 100%. 99.9% is not committed, okay? So that means you need to commit to yourself. If you want to produce phenomenal results with neurological conditions, you need to do my system as is and stop tweaking it, okay? Number 2, you want to remove all other sources, noise, influences, and stick with one system and write it. Too many cooks in the kitchen, you create disaster. If you're trying to use my system and then someone else's system, and you're trying to combine the two, you're going to have problems. I'm telling you, okay? Some of my associates in the past have tried to do that and they don't get results. And I said, look, just follow my system. I have a proven track record. Just do it, okay? Number 3, consistency is the key to success. You need to treat tons of people to have success. I've treated hundreds, okay, of like neuropathy, thousands of neurological conditions, okay? Treating 1-2 people successful is not success, okay? It doesn't make you an expert. It doesn't make you know it doesn't tell you that, hey, you're doing the right thing. It's over hundreds and hundreds of people. We treat over hundreds and hundreds of people every single week in my clinic. So we have proven success. How to get great results for your patients? Stop focusing on labeling your patients, okay? Patients, there's a typo. Patients themselves are focused on labeling themselves because it gives them a peace of mind. Physicians are focused on labeling them. Why is that? Why do you think physicians like to label people? Can y'all type in the chat? Why do you think they like to label? Will I get a drink? Why do physicians like a label? Why do patients like a label? Who knows? Exactly. Louise, perfect. Yeah, because if they label them, then there's a drug, there's a prescription, right? And so if there's no label, they can't prescribe because they do it cookie cutter style, right? We don't do cookie cutter. We do customized. So we need to stop labeling. So stop being worried. Like my example of the Tremors and the Parkinson's. It doesn't matter. I treat her the same way, okay? Focus on restoring organ function, not replacing. This is crucial. For those of y'all who are still wondering, oh, when is he going to get to the points? Okay, I'm telling you the most important part of how I get great results. I focus on organ function. So this is how I explain, like medication. Medication, it replaces a function in your body. What does that mean? It means when you take the medication, it helps you alleviate your symptoms. But once you stop, all the symptoms come back. Why? Because it is replacing a function in your body. With Chinese medicine, with acupuncture, we're not trying to replace anything. We're actually trying to restore function, okay? So that's the difference. That's what makes Chinese medicine so effective, right? And I've also studied functional medicine. So some of y'all have done functional medicine, right? Functional medicine also replaces function. I use some of my functional medicine training, but not much, because functional medicine, it's the only difference between functional medicine and medication is you're using a supplement versus a medication. Functional medicine uses supplements to replace functions in the body, right? Like melatonin. You can't sleep, and so you start taking a supplement of melatonin. Melatonin is a supplement, but it's also a hormone replacement therapy because melatonin is a hormone. So by you giving them a supplement of melatonin to help them sleep, you're making your pineal gland lazy, because your pineal gland is the gland that produces melatonin. But if you give your body melatonin all the time, your pineal gland is not going to produce melatonin by itself anymore. So how is that different from medication, right? So I like to say TCM is the OG of functional medicine, all right? So that's what, I practice. And so hopefully you got that point. So who's ready to take on the world? Who's ready to show the world the power of TCM? Because that's my mission. Who's ready to go with me? Nice. Beautiful, guys. Okay, so like I said, I'm going to tell you where who are my mentors, because I believe in full transparency, and I always believe in giving credit where credit's due. So acupuncture, my acupuncture system is called Quick Relief Acupuncture. OG, original gangsta. Okay, the original Godfather. Okay. Okay, so my mentor was Richard Tan, and for those of y'all who were not, were lucky enough to be able to be mentored by him, attend one of his, trainings, you missed out. He was the best acupuncturist in the world, hands down. Okay, I'm super humbled. I was blessed to be able to train with him. My herb system is based off of Fang Jia Fang, which is basically formulas plus formula. Okay. Two mentors from there. One is my foundations of formulas. His name is Gui Li Zheng. And my other one is Jimmy Chang, which eLotus has tons of Jimmy Chang's trainings. Okay. My diagnostics, I call it functional pulse diagnosis, is based off of Jimmy Chang's system. But I just simplified it. I'm not going to go into too much detail of pulse diagnosis today or tomorrow, unless I get 100 people telling me they want me to. But if you do, I will do it. Okay. And thermography, I do use thermography in my clinic, and so my mentors are Jimmy Chang for diagnostics and Dr. Google. Okay. Like I said, I'm not going to go over stuff that Dr. Google can share with you. Okay. Supplements, functional nutrition. I do supplements. I have functional medicine training. I did it for 1 year, and I do use it. But most of the information I get is from Dr. Google. Okay. Dietary modifications. I do a functional diet. You get in my drift? I like to restore function. Okay. That's my whole focus. Restore function, and the body will start working. So my mentor for my functional diet is what we learned in school, traditional Chinese medicine diet, and also Dr. Hiromi Shinya. He wrote a book called The Enzyme Factor, which I highly recommend you get. It's called The Enzyme Factor. This iPad is awesome. So buy that book. He's got like 3 books. My whole dietary system. So those of y'all, oh, what do you do for nutrition? It's really simple. Just buy this book and just copy it. Okay. All right. Let's go down and break down what we're going to do. Donna, can you be the one telling me when to take a break? Because otherwise, I'm not going to know when to stop. Okay, appreciate you. Day 1, we're going to get you the skill set needed to specialize in TCM neurology. Okay, we're going to go over neurological disorders that TCM can produce phenomenal results, and we're going to stick with today neuromuscular and headache disorders. Okay, there's subcategories of that, but that's what the main focus of today. But if I go fast through this, we can talk about more, or we can talk about more in depth. So this is an interactive. Okay, so you got to give me some feedback. All right, rules to play. Where do they go? There you are. So I do it interactive style. 60% of this is me talking. Remember, I hate talking. So I need you to entertain me, okay? So 40% is I need your questions, ask questions, type the questions only in the Q&A chat box, okay? Only in the Q&A chat box. Keep questions on topic, okay? All your questions are of equal importance. Don't be saying telling other people that their question is not important, okay? Every question is important, and I will answer every one of them. If I don't do it during this weekend, you can contact me via Facebook and I will answer it. Okay. Focus on understanding my system and take notes. You better be taking notes. Okay. I'm dropping like gold nuggets left and right. I'd love for you to talk about pulses with these functional disorders. Okay, Gail, that's one person. I need more people saying, I will talk about pulses, but not necessarily my functional pulse diagnosis. All right, subspecialties: neuromuscular, headaches, sleep, movement disorders, multiple sclerosis. This is the whole topic of this weekend. We're going to go through all of these, okay? The first two is what we're going to do this today. And I think even the third one. But we can improvise. So there's many neuromuscular disorders, okay? But the ones I'm going to be talking about are the ones I have success with. So peripheral neuropathy, trigeminal neuralgia, and Bell's palsy. Okay, and so there are like Lou Gehrig's. Okay, I've treated a few. I've had a little success, but again, I haven't treated hundreds of patients with ALS, and so I'm not going to share about it because I don't know for sure that my system works for it. But these three that I'm going to talk about, I know I got skills for these. Okay, so I know I can produce results, and I know you can too, if you learn. So peripheral neuropathy is my bread and butter. Okay, that's why I'm on the advisory committee for the Neuropathy Association. So that's number one. How many of y'all watched my neuropathy? Because I did a neuropathy webinar for eLotus. How many of y'all watched it? If you didn't, you can get more in depth about how I treat neuropathy there. So after this webinar, you can go and sign on and get the Gold Pass. Just get the Gold Pass. You can watch all my webinars. I did one on diabetes, and I go into my pulse and my QRA acupuncture in depth in those two. Okay. Awesome. Thank you, Amy. I will explain thermography at some point. Yes, Deborah. All right. So in order to treat a disorder, you have to understand. Okay, you don't have to label them. You at least have to understand what the hell it is so that you can communicate with your patients. So what is neuropathy? Neuropathy defined by this is from my Neuropathy Association, is a sickness of the peripheral nerves, a disorder of the peripheral nervous system that impairs its ability to communicate between the brain and the spinal cord to the rest of the body. Let me grab my little model. Okay, so my little model, okay. So peripheral neuropathy is the disorder of the peripheral nerves. So the peripheral nerves are anything but the brain and the spinal cord. They come out and they're the peripheral nerves, okay? They go down to the legs. All these are peripheral nerves. So when there's a sickness of it, it's called peripheral neuropathy, okay? Very simple. Move on. Now, again, definition. Two main categories of nerves, okay? We have large fiber nerves, and then we have small fiber nerves. So this is very important because this will tell you what you can help and what you can't help with. So this goes on during the initial exam as to, when a patient says, hey, doc, can you help me? Okay, so you have to know this information, okay? And large fiber nerves are basically what helps you position, sense, and balance, okay? And what you will see when the patients have large fiber nerves large fiber nerve damage, is you will see them wobbly, okay? They're usually using a cane or a walker. Some of them are in wheelchairs, okay? Not wheelchairs that often, but usually they're in a walker, okay, where they have braces on their feet. That's called an abnormal gait. And you'll see that they have weakness. Some of them actually, it looks like they have drop foot, okay? They can't pick up their legs because the large fiber nerves control those, all right? So if they have large fiber nerve damage, the chance of you reversing their neuropathy 100% is pretty much zilch, okay? But to improve, it's a possibility. About a 50% chance you can improve. It depends on how they were damaged. Okay, so there's many ways of damage, and I'll go through those. Okay, but large fiber nerves, the prognosis is not so good. All right, small fiber nerves, actually, these are the ones we can do phenomenal results. We can do like wonders for small fiber nerves. Okay, so small fiber nerves are basically, they help us sense pain. They help us sense pain, itch, temperature. Okay, so the symptoms that they will be experiencing is burning, shooting, allodynia, hypersensitivity. These are the things that they're going to experience. Let me grab a drink. I'm breaking up. Can y'all still hear me? Yes, okay. How do you whoever asked that question, yeah, you can't put it in the chat because like everybody else just did the chat and I just lost it. So put it in the Q&A section. There was something about large fiber nerves. I couldn't see. So put it into the Q&A chat, okay? So large fiber nerves, basically, here's the simple way of communicating to your patient. The bigger the nerve, so large fiber nerves, they're round, they're big. Let me draw it. They are, let's say, this thick. Small fiber nerves are like this, okay? Small fiber nerves are this small. So large fiber nerves, okay, when they're this big, if they've gotten damaged, let's say through surgery, they got severed, you ain't gonna reverse that, okay? It's permanently damaged, it's not gonna reverse, all right? But small fiber nerves, like these little babies, they can actually regrow. They can actually regenerate. They regenerate at 1 millimeter per day. That's only one nerve. How many nerves do you think you have in this tip of your finger? You have trillions of nerves, and they're all only growing at 1 millimeter per day, right? It's super slow. That's why the release is slow. So, but here's the beauty of small fiber nerve damage is that you can restore it. If you provide the nerves, if you provide the right environment for the nerves to regrow, the right nutrition, the right oxygenation, the right blood flow, the right, just environment, they will regrow at 1 millimeter per day, but they will still regrow. Okay, so that's the beauty, and that's the thing that neurologists really don't tell their patients is that it can regrow. Okay, any questions about that? Remember, questions, you need to put it in the Q&A chat. Oh, I didn't see all these. Sorry, I didn't scroll down. My bad. Jeanette Morris, do you use only tan or modified? Great question, Jeanette Morris. I use my modification. So it's a modified version of TAN's balance method. That's what I do. It's very simple. Like TAN's balance method is simple enough. Mine is even simpler. Okay, I'll go over it. Who wrote the enzyme factor? It's on this, Karen Boone. It's on the slide. On the slide, if you printed out the notes, it's on the slide, Dr. Xinhua. Have you ever treated any patient with FTD? I'm not sure what FTD stands for. Please define. What's the definition of sickness? Does it mean that damaged nerve or other? Great question, Sung Yoon Kim. So sickness means they're on the verge, the nerve is on the verge of dying or they are dead. So let's talk about the progression, okay? Let me see if I can get my little eraser. Here we go. Let's change color. So progression of nerve damage, pain. Take some notes. Pain is number one. Then you got your little burning. Okay. Then you got your little, you may even have some, I'll just keep a burning. Then you got burning, then you got pins and needles. Pins and needles. Then you got tingling. Then you got numbness. Okay, so these are the typical progression. Numbness is which? So these are the progression, what the patients will feel, okay? But when they come to you, they may be feeling all of the above already. But first, they start off with pain, and then it gets to burning, then it gets to pins and needles, then it starts tingling. When it hits numbness, you have nerve damage. The nerve is dead, okay? So that's why it's hard to restore nerve function when they're complete numb. Not impossible, it's possible, but it takes longer. So you got to think about it. You know, when you're explaining expectations to a patient, you know, what's the number one question that people ask? Okay, this one, type in the chat. So when you're answering my question, type it into the chat. But when you're asking me a question, type it in the Q&A. All right, guys? I know this is confusing, but that's what we're going to do. How long will it take? Yes, exactly. Lisa, Alexis, Sarah, exactly. The number one question is, how long is it going to take, doc? So think about these progressions, right? If they are a pure numbness, they have to go through all of these phases, restoring to get back to pain, okay? So it's going to take longer. But if they're only feeling pain and burning, these are the easier cases, okay? When they feel pain and burning, those are the easy ones. Let me delete this. But when they are numbness, tingling, you know, those are a little more difficult and they take longer, okay? So this is what you can tell them. How long will it take? I have no idea, okay? Everybody's body is different, but there's a way that we have a system. I have a system in my clinic that we do it step by step. So the patient is always they always know what to expect. But I tell them I have no idea how long it's going to take. It'd probably take months, right? I would tell you now, for numbness, it will take months. Not to see some benefit, but to get the maximum benefit from the treatments. So I would say, on average, I would say if they want to see significant improvement, at least a minimum of 50%, like improvement that holds. I'm not talking about they feel good one day, numbness feels good one day, and then the next day it's like terrible again. I'm talking about consistent improvement of 50% or better. It'll probably take you about 3 to 6 months, okay? Let me answer some more questions, okay? So is sciatica a small fiber nerve damage? Sciatica can be a large fiber nerve, Kazra. Numbness is which? Oh, numbness is small fiber nerves. Great questions, guys. How do you communicate to patients with large fiber nerve issues that they won't get much better? Great question. Y'all are asking great questions. So Megan Lindsley, how do you communicate to patients with large fiber nerve issues that they won't get much better? So obviously, you know, I'm not joking around like I am right now with them, okay? Because this is a serious issue. So I will tell them, look, because it's a large fiber nerve damage, the chance of me being able to reverse this 100% is pretty much zero. But to help you improve and regain some of your functions, your ability to walk, because if they have large fiber nerve damage, they're not going to be able to do basic things like ADLs, activities of daily living. They aren't able to do that with large fiber nerves. And that could be even bathing themselves, standing up to brush their teeth. It could be just taking a walk. with their dog, with their family, like basic things that we take for granted, they can't do. And so you have to be sensitive to that. And then I would tell them, look, my goal is to help you be able to do some of them. Will you be able to do all of them? Probably not. But will you be able to do some of them? Yes. That's something we can help you. Okay. Now there's a way that I test to make sure that that can happen. Okay. And I can go over that later on. Okay. So I'm going to keep answering the questions because all the questions are about this topic. Okay. So be patient with me. I can't see what you're drawing. Y'all can't see my drawing? Yes? Okay. I'm not sure why you can't see it. Okay, everybody can see it. Check with Donna. I'm pushing everything to Donna. Erica Fritz. What about optic nerves? It's small. Yes. Optic nerves can regenerate. Yes. However, I haven't treated one like neuropathy with optic nerve, but it depends on again, is it severed? Is a nerve completely severed? That's the key. If a nerve is completely severed, it is dead. Okay. Is numbness a symptom of small fiber nerve damage? Sarah, yes, I answered that. It is. So do you believe that large fiber nerves are completely off the table or your success rate is just reduced? Great question, Anjali. It's not completely off the table, like I just said. It is because remember what I started in the beginning was the most important. It's what the patient wants. It's not what we want. So you have to ask the patient, what do you want? Because they know their neurologists are going to tell them that there's nothing they can do, that they have to live with this for the rest of their life. So they already are coming in with that expectation. So for them to be able to walk, dress themselves, bathe themselves, go out to the mailbox, walk their dogs, that's a game changer for them. That's a life-changing situation for them. And if they consider that success, then who are we to say that we can't? That's not a success. So, it depends on them. Frontal temporal degeneration. I'm not sure. I am not sure. Semen Bazadi. Are you going to talk about treating compressed nerves? I have, yes, compressed nerves is a cause of neuropathy. Let me go to oops. Let me get out of this. No. How do I get out of this? There you go. Let's go to the causes. Oh, shoot. Y'all can't see this. I'll write it. So Western medicine causes for neuropathy, okay? So what this says is 33% is diabetes. 33% is diabetes. And then another 33% idiopathic. 33 idiopathic. And then what does this other one say? Other. 33% is other. So this is what Western medicine says about the cause of neuropathy, okay? 33% is diabetes, but I don't really see that many diabetic neuropathies. It's kind of weird. I mean, we treat a lot of diabetes and we reverse diabetes. And if you want to learn how to reverse diabetes, watch my webinar at eLotus on how to reverse diabetes. So we recently got a few, but the number one neuropathy number one cause that we get is chemotherapy induced. Chemotherapy-induced neuropathy is the number one neuropathy we treat with high success. I know some actors are saying you can't reverse it. Yeah, you can. So let me tell you the success rates on when you need to treat them. I mentioned this on Wednesday, but I'll say it again today. So with chemotherapy induced neuropathy, they need to start. If they start, so you want them to start acupuncture when they start chemo. That's the best time. Actually, the best time is before they start chemo. But the ones, usually people, when they come to us, they're already starting chemo. But if they are just about to start chemo, you tell them, get in, do acupuncture now, because you will help prevent more damage from the chemotherapy, okay? And you will have a high success rate, a 90% chance to reverse 90% of that neuropathy. I would say probably close to 99% of that neuropathy caused by that chemotherapy once they stop, okay? Then the second scenario is when they're finished chemo. When they finish chemo, then you still have a good chance of reversing a lot of it. I'm just thinking of, I'm looking at my Hall of Fame. I'm in my clinic right now, so I might be able to show you some cool stuff today. And I'm thinking of a patient on my Hall of Fame that she had chemotherapy, and she came to me the day after she stopped her last chemotherapy. And of course, she had the numbness, tingling in her hands and feet, and I reversed 99% of it. Okay, so third is done. It's just any time later. Any time later. So anytime later after the chemotherapy, the longer they wait, the longer it takes to reverse the nerve damage. But I will say, and I'll share, I think I have his thermal scan on this presentation. He had neuropathy all over his whole face. I think he had the chemotherapy 2 years ago before he came to see me, and I eliminated his neuropathy all over his body except for his hands and feet. But it is possible, okay? So those are the three main causes, and so when you're communicating with the patient, so if y'all are asking great questions, because I'm not seeing, what acupuncture points do you use? Y'all are asking great questions on how to communicate. How to communicate to your patient is the most important thing, because if they don't stay and let you do treatments for a few months, for 3 to 6 months, you ain't gonna get the result, okay? You ain't gonna cure neuropathy with one treatment. It ain't possible. Well, at least I don't know if it's possible. I haven't done it, okay? So these are the progressions that you need to ask the patient. So if a new patient calls in and say, hey, can you help with neuropathy? And you say, yes, I can help with neuropathy. So when should I come in? Well, I'm telling you right here when you should tell them to come in. You ask them, are you getting chemotherapy right now? If they tell you they're having chemotherapy, tell them you need to get in ASAP. The faster you get in, the more we can help you restore your nerve function after you stop chemo, okay? I hope y'all are writing this down. I am telling you the scripts on what to say to get people that can start treatments and stay with their treatments, okay? Western medicine causes diabetes. Over 50% of it's not showing. Over 50% of individuals with diabetes will have mild to severe forms of neuropathy. Severity is related to how long nerves are exposed to hyperglycemia. So we had a patient that came back. He has diabetes. I forgot what his A1C was. It was super high. His blood sugar was running about 200, fluctuating between 200 to 300. Yeah, dangerous. And so he came first 1 year ago, 2 years ago, and wanted help with diabetes. I didn't see him. My associate saw him, and he didn't want to, do the work, so he stopped. He just did a few treatments, and he didn't come back. Well, he came back last week or 2 weeks ago, I forgot, and his diabetes is a little better, but it still ain't that much better, okay? And guess what he has now? He has neuropathy. Now he's hurting his arms, his legs, okay? So this is what what this means. When you are exposed to hyperglycemia for 2 years, it's going to damage your nerves, guys. Okay. So you got to get serious with these people. All right. Let me answer some questions. Got tons of questions. Such as, these are for small nerve. Daniel Metzger, are you going to talk about treating compressed nerves? Yes, I will be. Who's owner? Do you help grow small fiber by internal or external method? Does external method has the same effect as internal method? I'm not sure what you mean by internal method or external method. Can you elaborate, owner, or put your real name, okay? Anjali Sharma, these are for small, I'm not sure what you're talking about. Drop foot, yes, it can help for drop foot. Jeanette Morris, but what if numbness without the others? Numbness is small fiber. Yes. Jeanette, we have tons of, so I think I deleted it. Let me see if remember I can't go back. Remember the progression of the symptoms? Pain, okay? Burning, right? Tingling, pins and needles, tingling, numbness, right? So when you start restoring the nerve function, the patients are going to be experiencing those things, those symptoms. Why? Because the nerves are regrowing, okay? When the nerves are regrowing, they start sensing things. So patients are going to be like, oh man, I used to not have tingling, now I'm getting tingling. I used to not have pins and needles, now I'm getting pins and needles. I used to not have burning, and since I'm coming for acupuncture, now I'm getting burning. So what do you say to them, right? You say, great, that means your nerves are regrowing, because first they were all just numb, right? Numb means dead. But as your nerves regrow, they start sensing. When they start sensing different sensations. So the fact that they're getting all these things is a great thing. Continue the treatment, continue the course. Do not stop. If you stop, it's going to go backwards, back to numbness again, okay? What if there's numbness without a progression through other symptoms? Yehuda, there's always a progression. There's always. They don't just jump from nothing to numbness, unless actually the compressed nerve, but even compressed nerve, you'll feel pain first, okay? It's just when they come to you, they're only feeling numbness, but they've had years of pain that they ignore, that they don't remember. So you have to ask them, okay? Let's see. How about hearing loss? Can it be reversed? Patient, great question, Marat. I don't treat hearing. I haven't, not that I don't treat, I just haven't got a lot. I don't know. That's a great question. I know I treat tinnitus. I get 50% results with tinnitus, but we're talking about neurology. So Vignesh, when you treat nerve damage, as the patient gets better, do you see the symptom? Yeah, I just answered your question. Are you going to show us step by step of treatment? Owner, yes, owner, I will. When patients improve from numbness to the symptoms show, yep, answer that question. Is age matter of neuroplasticity? No. It's nothing to do with age. It's really the health of their body, the health of their nerves, the health, really organ function. You see when I talked about earlier on, you all see everything that I talked about before is vitally important. So organ function is the most important thing. How well are their organs functioning? The 80-something-year-old that I treated with neuropathy that had all over his face, he was the first one that had neuropathy all over his face, his whole body, that was the first case. Usually the neuropathy patients that I treat are only hands and feet, okay? So all over the face, he was 82, I think. I forgot, I have it in the slide later, okay? So it has nothing to do with age. Why is it that some patients only experience numbness as first symptom if pain is first? Again, they just don't remember. Scott. Would this help for neuropathy caused by electrocution? Oh, that's a great question. I have no idea. I've never treated somebody who's been electrocuted. Okay. So Jennifer Dabu, just hopefully you can use my treatment systems and let me know. Okay. It should. It doesn't matter. Remember, it doesn't matter the label. Remember, we're not labeling people. It doesn't matter the cause. We know the nerve's damaged, okay? We just need to provide the nerves with the right environment, the right nutrition, right oxygen, blood, and it will reverse. It will regrow. It's just a matter of when, not a matter of if, okay? Unless it's, let me emphasize that if it's large fiber nerve damage, it will not regrow, okay? How many treatments per week when considering the prognosis? Jenna, I will go over that. These progressions are for small fiber nerve. Yep, Anjali. Muscle function, also be a sign of symptom nerve. Yep, Tar Muhammad. Yes. How often do you see the patient in a week? Kim V, I will talk about that. So, okay, I'm gonna go continue on and then I'll come back and answer some more, okay? I'll just go back and forth. Other causes are inherent. I'm not gonna spend too much time because guess what? Dr. Google can give you this, all right? I'm not gonna waste your time on what Dr. Google can give you. Toxins, heavy metal, vitamin deficiencies. Western medicine, neurologists, they like to give Metnex, which is a high vitamin B12, I believe. It doesn't work. It doesn't work at better than just, a good supplement, a good vitamin B12 over the counter that's third-party tested and pharmaceutical grade. And I'll share with you what I use, okay? Underactive thyroid, I don't get too many of as underactive thyroid as the main cause, okay? Autoimmune, I do get the CIDP, chronic inflammatory demyelinating polyneuropathy. The number one treatment for neurologists is IVIG. So basically they put IV immunoglobulin into the IV, and that does help. It helps them regain their strength. But acupuncture and the TCM works better. Okay. Other causes, kidney, liver, malfunction, infections, trauma, pressure on nerves. Okay. So since someone asked about this, pressure on nerves, if whatever is pushing on the nerves, a physical bone is pushing, let me draw it. It's easier. I think it'll be more clear. So let's say you have a physical, this is your vertebrae, and here's your disc, okay? And here's your nerves coming out from here. So if you have let me draw one that's out of place. Okay. So if you have this right here, let me change colors. This right here, okay, where the bone is actually physically pushing on the nerve, acupuncture ain't gonna do much for the neuropathy until someone removes that bone off the nerve, okay? It doesn't mean if it's a bone, it's a disc. Something physically is pushing on the nerve. You have to remove that whatever, okay? If you don't, then basically your acupuncture can still help, but you're still gonna have the neuropathy, okay? You can help it, it'll get better, and then it get worse. Get better, and then go back. Better, worse, right? So this is where, I say, hey, chiropractic, spinal nerve decompression. Chiropractic is very good, not for adjustments necessarily, but spinal decompression, right? If you tag team with a chiropractor, have them help you remove whatever is pushing on the nerve, then you can help restore the nerve function, okay? One of the common, I would say there's something harder to treat than chemotherapy-induced neuropathy, and that is spinal trauma to the spine. And what was the trauma caused by? The trauma was caused by back surgery. That is actually harder to treat sometimes, because when the surgeon's going in there, they're cutting everything. They're nicking things left and right. Of course, they're not going to admit it, but the patient, before they went in to surgery, back surgery, they didn't have neuropathy. Coming out of surgery, they have neuropathy. It's like common sense stuff, right? So in those situations, it depends what damage the neurosurgeon, not neurosurgeon, but orthopedic it could be a neurosurgeon, the orthopedic did to damage the nerves. And so those are kind of hard to gauge, especially when it's for surgery, okay? Okay, so this is important, okay? So I'll spend just a little time on this. Western medicine diagnosis is very important in regards to neuropathy. Neuropathy, so EMG, NCV, nerve conduction test, electromyography, these are very important. EMG is basically they jab you with needles from one side, like if it was, let's say this is the leg, okay? So this is the leg. They're gonna jab you, and here's the foot. Here's my little. They're gonna jab you with a needle right here, and then jab you a needle down here, and they zap you. Okay. What they're doing is they're trying to see the conduction. They're trying to see if the nerves are alive, right? Mainly, these two tests, EMG and NCV, they only test for large fiber nerve neuropathy or damage. Large fiber. Okay, they do not tell you anything about small fiber. Small fiber, they need to do a nerve biopsy. Okay, so how do I know this? Because my neurologist friends tell me. Okay, this is not from me. I don't do these tests. I can't. It's not my scope of practice. But my neurologist friends, this is what they tell me. Okay, and so the CTs and the MRIs, they're to see if there's any structural damage. Structural damage of something physically pressing on the nerves, okay? And they may do blood work to test for autoimmune, okay? So if you have a patient who is hobbling in on crutches, not crutches, but a walker, and they have not gone to a neurologist, I would highly recommend that you go send them to a neurologist and have these tests done. Mainly the EMG and the NCV. We want to rule out large fiber nerves, okay? Remember, because large fiber nerves, the prognosis is not so good. The small fiber nerves, they don't need a nerve biopsy, okay? Again, they do a nerve biopsy. Why? Because they want to label them. Is it necessary for us to treat? No. But the large fiber nerves, it is necessary for us to know, because then we can set the right expectations for our patients, right? All right. Let me answer some questions really quick, okay? How many treatments does patients need to get to determine if acupuncture? Nancy, I will answer that. Someone who has sciatica and diabetes neuropathy numbness takes longer to treat. Shizu Ito, someone who has sciatica and diabetic neuropathy numbness takes longer to treat? Not necessarily. Again, I will tell you I will show you, guys, don't worry, okay? The step-by-step treatment system, like I said, I can go over I can finish it in 5 minutes, okay? That's not so important. This, is important. This is about setting expectations. This is about communicating to get the patient to stay long enough for you to do the treatment plan, okay? Don't be worrying about the treatment plan right now, okay? Nancy Gallen, I will answer that. Parkinson's would be a large fiber nerve issue. Ooh, I don't know. I don't have a lot of experience with Parkinson's, Sonyism. So I don't know. I can't answer that. Simon, yes, you asked what is FTD. I don't know what FTD is. Can you elaborate? Is that right? I'm not sure if part one of this seminar, sorry. So when you say you can help regain function if large nerve fibers are damaged, are you talking about peripheral nerves regeneration? Yes. So Peiru Chen. So Peiru asked, so when you say you can help regain function if large fiber nerves are damaged, Are you talking about peripheral nerve regeneration? Yes, because you can't well, I have yet, not I can't. I shouldn't be saying you can't. I have not yet found that I can regenerate large fiber nerves. So the nerves that I am regenerating are small fiber nerves, okay? Anjali Sharma, please answer. I'm not sure what you want me to answer. Do you consider drug-induced tinnitus an issue of peripheral neuropathy? Oh, could be. It could be. Everything is neurological disorders, guys. That's why you can use my system to treat anything, any disorder. It doesn't have to be. I use the same thing to treat fertility, but that's off topic. Don't ask me questions about fertility on this one, okay? What is your frequency of treatments? I will go over that. What about drug-induced neuropathy? Post-chemotherapy, cancers that cause it. I have a patient that gets off the meds. Anjali, I already answered that. Did you sell treatment plans to help with compliance? Nancy, yes, I do. Nadine, what if brainstem stroke now with numbness, which has been over 6 years, or any issues that has been a while ago? Ooh, great question. I don't treat that many strokes. So I don't know if it will help, but it's worth trying. We recommend both. Lucian, Dr. Shinya's book, The Enzyme Factor, he has 3 books. I recommend all 3. Is large fiber nerves associated with aging? Good question. Don't know. I just know the large fiber nerve damage are usually caused by some type of trauma. It's usually like spine surgery, or neck surgery, or brain surgery, or tumors. That's what I usually find. Okay. Anjali, when you say hyperglycemia, are you saying patients with uncontrolled, unmedicated diabetes, or those who have daily fluctuations in their blood sugar? Great question. So Anjali, what I'm saying with hyperglycemia is basically the blood sugar stays elevated for too long. So if their blood sugar is elevated, it could be 150. If their fasting blood sugar is like 150 every single day, and you leave that for how many years, I mean, yeah, that's going to damage the nerves. So the diabetes, diabetic neuropathy doesn't occur overnight. It's years and the patient can be on medication. I'm not talking about if they're on, I'm just talking about the fact that there's high levels of sugar in their blood for years, every single day, okay? What is the significance and treatment approach for numbness without the progression through or presence of other symptoms? The treatment is the same. The treatment's the same, and without the progression through it, again, like I said, just because they don't have pain right now does not mean they didn't start off with pain. Okay, so if they come to you, may be presenting just with numbness. It doesn't mean that they did not have pain once before. The treatment is going to be the same. The only difference, the reason why I told you the progression of the symptoms is so that you can communicate with the patient what to expect. Like what are they going to expect to happen? Because patients, all they can do, I mean, how are they going to know if they're progressing or not? Right? So the way that patients, determine if they're improving or not is 2 things. Number 1, you want to write this down. Number 1, symptoms, what they feel, right? If they feel better, they think they're getting better. Number 2, function. Are they able to do something more? Are they able to walk 5 blocks versus 1 block? These are the 2 things that you can have your patients monitor, okay? Monitor to track their progress. And when you're treating them, you're asking the patients these questions, because it's also for you. If they're moving up, if they're going from numbness to tingling to burning to pain, that's telling you, hey, the nerves are regenerating. And here's another tidbit. When nerves start to regrow, a lot of times they'll get something what I call these jolts. There's jolts of electricity. Okay, it's like short circuit. It won't be constant. It'll just like come and go jolts. That's a great sign. Okay, that means the nerves are regrown. Okay. Okay, let's see, Sung Yoon Kim, the progression of nerve damage always following those sequence, or can it randomly happen? Depends on the patient. Yes, Sung Yoon Kim, it can randomly happen. It doesn't have to go that step by step. Jeanette Morris, what does it mean if it went straight to numbness without pain or the others before? No, just went to numbness. Like I said, the only situation that I've seen where it goes straight to numbness is, actually not only situation, there's a couple. One is the spinal injury, right, whether through surgery, and some chemotherapy. Chemotherapy can go straight to numbness. But it's rare. I'm thinking it's so rare because they usually have tingling, pins and needles with it too. It's rarely that they just go straight to numbness. All right, let me go a little more. I'm going to go back to the slides and I'll come back to answer questions, okay? So Western medicine treatment, diabetes, toxins, vitamin deficiency. Okay, I already went through all this. You can go through Google. You don't need me to tell you that. Inherited disorders, idiopathic. They've tried all of these things. These are what neurologists give them: anti-seizure meds, antidepressants, analgesics. The only thing so this is something you want to pay attention to. The only medication that could potentially help people with neuropathy, okay, is their famous medication called gabapentin, aka Neurontin. This actually can help with pain and burning. It can actually help with it, okay? But numbness, nothing. It won't do anything. All right. Let's go to the TCM view, okay? I know I spent a lot of time, answering, but a lot of the way that I'm teaching you how to communicate expectations, you can apply that system. So remember, it's the way to make decisions, the system for every neurological condition that I'm going to be teaching this weekend. So take notes, right? So TCM view, basically the way I do treatments, I combine today's information, so Western medicine information, today's technology, and past information. The reason why I told you have to have an open mindset to the way I do things, because I do things different, okay? I do think in TCM terms and Western medicine terms, but I don't think separate. I combine them both. I don't think there's a difference. I think medicine is medicine because my number one focus on every neurological condition is to restore function. That's all my focus is on: function, restoring function, okay? So it doesn't matter if it's TCM, it doesn't matter if it's Western medicine, function is the game. So the real cause of peripheral neuropathy is actually lack of oxygen, okay? Lack of oxygen is the cause. Every single cell in your body needs oxygen. That's the number one nutrient your body needs. Your body cannot survive. No cell can survive without oxygen. It can survive without blood. It can't survive without oxygen, okay? So in this picture, you'll see this top part. You'll see this is a normal nerve conduction. You can see there's a synaptic junction right here. That's how nerves communicate. They don't actually touch each other. They communicate, okay? I know I wasn't going to get into the scientific stuff, okay? This is the only time I'm getting to the scientific stuff, okay? So they communicate, by sending little love notes to each other, okay? Called neurotransmitters, okay? But they send these love notes between each other, and they need to be close. Otherwise, the other party is not going to get the love note. Okay. But what happens when you deprive the nerves of oxygen? They start to shrivel up. And when they shrivel up, that increases the space, the synaptic junction. And so it makes it hard for the nerves to communicate. Just think about it. When we were in, high school or middle school or elementary school, and you were sending some love notes, right? If your person that you're sending the love note to was not in the same classroom as yourself, it makes it difficult for y'all to communicate secretively, right? Versus if the person you were trying to send the love note to was sitting right beside you, it's easy. You just hand it to them, right? So that's what oxygen does. Oxygen deprivation is the main cause of nerve damage. So if we know that, then the solution is basically bringing more oxygen to the nerves, and they will start regenerating, right? So here's my secret treatment strategy. Many of y'all were waiting for this. Okay, identify the cause. So what is causing the oxygen deprivation? That's the key. Oxygen deprivation, what is causing it? Those causes that I listed, all of those cause oxygen deprivation. With too much sugar, that's slowing down the blood circulation, or someone actually cut it through surgery, or someone had toxins, chemotherapy induced. Idiopathic cause, it could be lifestyle, could be dietary, crappy diet, stressful lifestyle, they decrease oxygen. Just think about it. When you are stressed, not everybody does this, but have you ever seen someone who's super stressed and they start to hyperventilate, or they start to breathe really shallow? Guess what's happening? They're not getting enough oxygen. Make sense? Okay. Yes, Luis, when anguish, you don't breathe properly either. Yeah. So if you don't there's a lot of emotions that can cause, but it doesn't happen overnight. It's years and years of this lack of oxygen, and that causes nerve damage. So what is oxygen? So I know I'm not going to get into the politics of this, but this is only my own interpretation. I can read Chinese and I can write Chinese. So this is the word. This is the Chinese word for qi. Hey, why isn't it showing up on the screen? Ooh, must be super. Can y'all see that word? No? Why is it not going on the screen? Just be a delay. Okay. What's wrong with my iPad? Come on. Told you there might be some glitches. Because it's in Chinese? Maybe. Maybe. Let me see if that works. All right. Let me write it big back here. Okay. Okay. It doesn't matter. If you don't read Chinese, it really doesn't matter. So qi in Chinese, the character qi in Chinese actually means oxygen. Okay. It does not mean energy. I know people translate it as energy. There's the character for, this is a bummer. Oh, I cannot. Let me see if I switch. Sorry, I'm trying to use, there's some sync problem with my iPad. Well, anyways, I'll just verbally tell you. So the Chinese word for energy is actually called 能源, which is not qi. Okay, so qi actually means oxygen. So if we can just move qi or oxygen to the nerves, it will regrow. And how is oxygen carried? Through the blood. That's why we have qi, 血, 血 in Chinese means blood. So TCM diagnosis is qi and blood deficiency and stasis. Okay. I'm going to stop share and then share again. Hold on, guys. I'll be right. Share screen. Let's try this again. Okay. There we go. There we go. This is actually the character. Oh, I forgot I think that's how you write it. That's energy. This is energy in Chinese. Okay, but again, I'm not getting into the politics of it, just letting you know my take. So what causes the oxygen deprivation? Inflammation. Inflammation from diabetes, medication, toxins, stress, okay? Nerve impingement, spine surgery, brain surgery, right? These are what causes oxygen deprivation. And so, but it's really inflammation is a key part. So if we can address the inflammation, then we can improve blood circulation. We can improve oxygen delivery to the nerves. And guess what? That's what acupuncture does. Okay, very simple. Okay, let me answer some questions, okay? Whoa, and Andrea Winchester, what about secondary causes neuropathy? Diabetes caused by autosomal dominant primary polycystic kidney disease. Dang, that was super long. The approach is going to be the same because all that diabetes caused by autosomal dominant primary polycystic kidney disease is just a label. Julie Allman, have you treated multiple system atrophy? And if so, could improvement be expected with numb legs and balance problems from this cause? Yes, it can. Yahoo, there is no history. This is myself. Oh, Yahudit, maybe so I can get a more, why don't you, I'll give you my email that you can email me and I can answer your question in more detail, okay? I'm not ignoring you, it's just there's tons of questions. And so, do you take insurance or how are they able to afford the treatment depending on how often they need to come in? Kim V, great question. I will answer that when I go to the treatment plan. Dr. Anjali Sharma, would you categorize Parkinsonism to large nerve issue? I don't know. I don't know. I know there's small nerves involved. I don't know. Like I said, I don't have that much experience with Parkinson's. Alan Kojima, do you have experience treating neuropathy associated with autoimmune disorders and will your system be affected? Yes. So CIDP is the most common one. Chronic inflammatory demyelinating polyneuropathy. Yes. CIDP is the one I treat most commonly for. And yes, it can be effective. Electrocution is cauterized nerves. Yeah, Linda. Let me know how it works. I just haven't had that experience yet. I haven't had that patient yet. If Eva Chu, if numbness has taken place for 4 decades, could it be reversed? Very hard, very hard. It's still worth a try. And we're getting close to how I figure out how we know definitively if it's gonna work or not. Patient was using jackhammer for his work as construction. In 1 month, he had tingling and numbness in his hands and running down his arms. Kim V, that may be because structural damage in the cervical spine. Do you treat type 1 diabetes? Nikita Sen, no, I do not. Not that I don't treat it, I just don't have patients that come in. Simon Bazati, Are you going to talk about treating dizziness? Not really. Andrea Winchester, you came to my question, you answered it. Oh, Dr. Martha Hall, can Charcot Marie tooth? Oh yeah, I've only treated one. Very difficult. I don't have enough experience, so I don't know. But I will use the same treatment process. Guys, it's the same treatment. Remember, all of these are just labels. That's why I took time talking about labels, okay? Some people may have thought, oh, that's a waste of time. I'm talking about labels and stuff like that. That wasn't a waste of time. This is the reason I talked about it. I don't waste slides. I don't waste words. Anonymous attendee. Why don't you put your name, anonymous attendee? I think in my case, the problem is in the definition of numbness. Maybe numbness is a lack of sensation, and this is not the case. But still, there are other symptoms present. It's just a sensation of cardboard, yet this is along with full sensitivity. Yes, anonymous attendee, great question. You can have numbness and also feel pain at the same time. Patients can feel numb and tingling and burning at the same time, okay? Why? I have no idea. They just can't, okay? But yes, you can have a cardboard sensation. Another one is they feel like they're walking on cotton balls, okay? They feel like on the bottom of their foot is like cotton balls. That's one. Some people cannot feel tile. They can't feel the carpet, but they are hypersensitive, at the same time. If you touch them with a sharp object, then they're actually hypersensitive, okay? So you could have all of those. The progression of the symptoms is not a diagnosis for y'all. It's a way to communicate to the patients, right? And there is no cookie cutter thing. People can have everything. You can have Yahoo that was saying just went straight to numbness. Maybe you did go straight to numbness. I just haven't seen it. I'm not saying you're wrong. All of you are right. Everybody's right. I'm just letting you know my experience, the patients I've treated, okay? Eva Chu, have you seen any numbness of fingers and shaking of the whole arm leading to non-functional of the right hand due to mental trauma? Due to mental trauma? Nope, not yet. Will you discuss treating TOS, carpal tunnel? Jeanette Morris, what does TOS stand for? Katie Joy Starr, after nerve tests in Western medicine, will they do surgery? I'd be a little nervous to send a patient to them if so. So great question, Katie Joy Starr. I send my patients to neurologists all the time. I highly recommend you do too. If you want to treat more neurological conditions, you need to refer out, okay? Western medicine diagnostics are great. They're great. MRIs, awesome. I love them. Ultrasounds, love them. Nerve conduction test, love them. Nerve conduction test is not so painful. They just put some pads on the muscle, okay? It's the EMG that's painful. At least I've heard is painful. I have never done it, okay? But I've heard it's painful, and yes, I recommend you refer them to get it done. No, they're not going to do surgery. There is no surgery to do. There's no surgery for neurologists, okay? For neuropathy. Maybe the only surgery they do is a nerve biopsy. That's the only thing. Okay, let me get back. TCM neurology. All right, so initial exam. What's the goal? So my first visit is initial exam. I don't do consultations, okay? Initial exam, I determine their potential root cause. I determine the organ dysfunction. What have I been talking about all this time? The organ function. Eliminate possibilities and rule out structural problems. Because if they have structural problems, then you need help. You need someone else to help you. Not that you can't treat them, you need additional assistance. But the other causes, you can treat them yourself, okay? So these are the things that's going through my mind when I'm examining them, okay? I'm not asking about how their day is. I'm not asking about, you have well, actually I do ask family history really quick. Does it really matter? Not really. So I don't spend too much time asking useless questions. that don't get me to, that's going to affect my treatments, okay? The diagnostics that I use my functional pulse diagnosis, which is a version of Jimmy Chang's pulsinergy. It's just super simple. Next, neuro exam. I do neuro exams, Romberg's, Tandem Gate, Pinwheel, hot, cold sometimes. And I'll show you some videos about it. I'll show you I'll see if I can demonstrate it here. And we also have thermography, okay? And I'll go over thermography also. Do you need to have thermography in order to treat neurological conditions? No, you don't. I didn't have my neuropathy camera until 2014-ish. So when I started my practice in 2007 to 2014, 7 years, I had no thermography camera and I was still getting great results with neuropathy. But I just have it now because I got money now. All right, so cryo stick. So these are some of the things that you can do, okay? So cryo stick is basically you're testing a cold sensation.
Hello, Jimmy. I'm sorry to bother you.
Yeah.
Can we take a break?
Okay, perfect.
What time do you want to return? It's like 10:47 right now.
It's 10:47. Like 10:47, so that's 11.
Oh, sorry. Yes. Okay, I forgot you're 2 hours ahead.
Yeah, I'm trying to calculate some time here. So 11, my 1.
Yes, that sounds perfect.
Okay, you're 11.
Let's return at the next hour.
Okay, yeah, better.
We good? Okay. Hi guys, welcome back from the break. Before we get back, I wanted to share with you our TCM points section of our website. It's brand new, it's just finished, and we're so excited to share it with you. Basically, it's the 12 channels and the extra points and the REN and the DO points, where the location is, indications, and applications. And my favorite part is the balance method points, balance method information, I should say. So you can see my screen right now, right? All right, so I'm going to try and balance the microphone. Oh, I'll see. Okay, so this is how you get to the TCM points from our website. You go to elotus.org, and I'm going to type in my username. Okay, I typed my password so fast so you can't see it. Okay, so then on the top, you'll see core. And you click on that. And so what is core? Core stands for a collection of real essentials. And here is originally where we only had Master Dong acupuncture information, and you can see that right here. So later you can browse this area, browse this section. And I just added the pictures for the 77 points and 88, which is the lower legs and thighs. So take a look at them. I'm so proud. It took so long to do, and it's finally up. But today I wanted to share with you the TCM points. So if you see here, I moused over TCM acupuncture, and it lists all the principal channels and the extraordinary channels. And there are pictures on here. The pictures that are available are just the limbs. So I'm currently working on the torso and the back. So it's in progress. Let me show you the lung. So if you click on lung, it talks about the lung channel, the pathway, the points, indications of the lung channel, applications, and the balance method points. So if the pain is on the lung channel and you want to use system 1, you can just look here and it'll tell you to use the spleen and needle the opposite side. So easy. And I'll show you lung 1 as an example when you go into each point. So here's our beautiful picture, and it has lung 1 showing you where it is, location, indication, application, and here it is, balance method again, is the lung channel. Which system goes with the lung channel? And also techniques and special remarks. So we hope you guys like it. This is free. As long as you have an eLotus account, you can access it. So everyone here has an account, otherwise you wouldn't be here today. So when you have time, take a look, and we hope you enjoy it. So a lot of hard work, sweat, and tears have gone into this, and we did it for our TCM community. So we have one place that you guys can all go to for all these resources and CEUs. So we hope you like it, and we'll go. Jimmy, you can go ahead and take over now. Okay, Jimmy, you can go ahead and take over the PowerPoint.
Okay, sorry. I was wondering, you kept on kicking me out.
You're mesmerized by my talk.
All right, let me see. I want to grab my little tools for diagnostics. Awesome. There we go. Okay, let's get going. I got to move a little faster. Okay. Got a lot more stuff to go over. So diagnostic tools for neuropathy, not diagnostics, but really monitoring tools, because we don't diagnose. Not in the state of Texas where I'm at, we do not diagnose. So we need monitoring tools. We need to monitor progress, right? How do you know how do you monitor patient's progress? Because if you've treated neuropathy before and people who have numbness, you will know it is very hard to distinguish if the numbness is progressing, is improving or not. Because the patient, this is one thing that the patient is going to say to you, the numbness is the same. I feel it's the same. It's still numb. And the reason why they say that is not because they're not trying to help you out, is because when you have numbness, it's hard to differentiate, oh, is it a 1 out of 10? Is it a 9 out of 10? Is it a 5 out of 10? It's very hard to distinguish that. And so when people with neuropathy, they only have one thing that they think about. Do I have the numbness or do I not? So as long as I have the numbness, I'm not improving. It's the same, okay? But here's the thing. They could be improving. They just can't identify it as improving. So remember I said there was two things. There was two questions or two ways that you monitor, that the patient can monitor to see if they're improving. So symptom was one of them. What's the other one? Where's my chat? Can anybody tell me what's the other one? There we go. There's my chat. Check. Function, yes, function. Manda, Quinn Liu, yes. So you have to ask them, oh, so how, were you able to walk down the street? Were you able to stand and change your clothes? Were you able to take your dog on a walk? Were you able to go shopping with your wife? You have to use those as a way to monitor progress, right? Even the tools that I tell you today, that I'm showing you, I'm going to show you right now, they're still subjective. So that means the patient has to give you the feedback, right? And so even using, so the first one, this cryo stick, my cryo stick is stuck to my fridge, so I couldn't pry it out. But you can use anything that's cold, right? Anything that's cold, and you just touch their skin. You touch it, you touch someplace that it's not, they don't have numbness or they don't have nerve damage, tingling, burning, and so forth. You can use even this pinwheel. Use the handle of the pinwheel, and just go to their face and go, bam. Did that feel cold? And they're like, yeah. Okay, so this is a 10 out of 10. And then let's say their hands, they've got neuropathy in their hands. They got a little numbness and tingling, okay? So you go, 10 out of 10. This is 10 out of 10. What is this? If this is 10 out of 10 cold, touch the finger. What does this feel like? Right? So that's how you do it, and then you chart it down, right? You don't have to do every single part of the hand. You can just do like, you can ask them, where do they feel majority of the numbness is? So if it's most of the time, it's going to start in the fingers. So you'll go the face, this is 10 out of 10. And then you'll go here to the fingertip. So what does this feel like? And I usually have them close their eyes, okay? But tell them you're gonna touch their face. Otherwise they're thinking you're slapping their face, okay? So touch their face, and then touch their finger. Touch their face, touch their finger. 10 out of 10, okay? You don't have to go through all 5. I would just ask what place is worse and just touch those areas. And then the other hand. And if it's the foot, you do it on the foot. Top of the foot, bottom of the foot, same thing. Pinwheel is the same thing. Let me see if you can see this. So you need to have your skin exposed, right? So usually what I do is I will use a pinwheel, and I will just go to an area where they don't feel the numbness. And I just use the weight of the pinwheel. So I'm not pressing down. I'm just using the weight, and I'm just guiding it. Like if you can just hold it with 2 fingers, and just see it kind of just use the weight of it, right? So I just use the weight of it and then just kind of guide down, okay? And they should feel, this pinwheel is pretty sharp. So they'll feel the sharpness. So I'll go, okay, this is a 10 out of 10 sharpness. And then, I'm tearing up my shirt. I'm doing that. Dang it. So then you go, okay, what is this? So again, it's crucial that you're not pushing down, because you want to apply the same amount of pressure when you're testing, okay? So when you're testing, you want to apply the same amount of pressure. So that's why I just like to use the weight of the pinwheel. I don't really push down on it. And so here, I'm just going like this. See? Here, let me, my little screen is small. I'll come back to my screen. So let me show it this way. There you go. Y'all can see it better now, right? Let me unbutton. What happened to my chat? So I can see what y'all are talking about. Chat. Oh, chat's on the side. There you go. So what I'll do, sometimes you can just use the arm, because the arm a lot of times is not numb. So I'll go in the arm, and I'll just use the weight of the pinwheel, okay? Weight of the pinwheel, okay? I don't literally hold it like this, but I'm just showing you, I'm exaggerating it, okay? I'm going like this. I can hold like this, but I'm still using the weight of the pinwheel. See? The weight of the pinwheel. Weight of the pinwheel, and just go here. Oh, does that feel sharp? Okay, feel sharp? So this is 10 out of 10, okay? And then what is this? Go on the finger. If this is a 10 out of 10, this feel. And I have them basically give me a number, a gauge, okay? And then remember, you don't have to do every single area. You want to just get a reference point as to how severe it is, the numbness is, or the neuropathy is, okay? So pinwheel, go here, and then you go in here, you go into here. So here, this is 10 out of 10. What is this, right? And then go into the fingers, okay? There, and then that's how you test it, okay? So that's a pinwheel. The cryo stick, it doesn't really matter which cryo stick you use. I just got a block of, I have those ready, those things you can just stick in the refrigerator and just forms like a little ice pack, right? You can just get that, slap on that baby. This is 10 out of 10. What is this? This is 10 out of 10. What is this? Okay, make sense? Okay, let's move on. Let me see if I'll keep on this screen so I can show you. Here's my little kit of neuropathy tools. Okay. This is called monofilament. I don't use this that much, but I used to use it, okay? There's a specific technique, it's called a Toronto scale, but I don't do all that, okay? But I'm just showing you could do this to determine how sensitive, okay? You basically see if they can feel this light touch, okay? But I'm not gonna spend too much on stuff I don't do, okay? So let me just tell you what I do. But I'm just saying these are part of the stuff I've done before, but I just don't do them now. The pinwheel is definitely one of them, and you could use vibration. I don't do it now either, okay? Because I like to use more function. So out of the subjective, I use the pinwheel a lot. I use the pinwheel because it's quick and it's easy to feel sting. You could use a needle. If you don't want to use this, you can use a needle, right? Sometimes I'll use a needle and I'll just, prick. And I don't have a needle here. I'll have to go grab one. But I would just go, if this is a needle, I would just, oh, you feel that? They go, ow, yeah, I feel that. Okay, great. Do you feel that? Oh, no, I don't feel that, right? So what is that? This is a 10 out of 10. What is this? How intense is it on a scale of 10? So I would chart all this during the initial exam. I would do this during every re-exam. So every time I re-examine them, I'm doing so everything I do in the initial exam, I redo it at the re-exam. So we have consistent data. The key to neuropathy, because like I said, neuropathy, it's hard to gauge improvement, okay, for the patient. Like it's hard for them to sense that they're improving, feel that they're improving. And if they're not mobile, then it's hard to gauge function, right? So those are the tools that I use. Let me go back to the slide, okay? Okay, so let me go back. So this was the monofilament, which I don't really use. I don't really use a tuning fork as much. The Meditip, this is where I use DBC needles. I use needles. And for the hot sensation, I would use a blow dryer. But again, I don't do these anymore, but I'm just letting you know this is what I've done in the past, okay? Oh, let me come back to that. Let me get a little cough drop. I'm losing my voice. I'm gonna be talking a little softer now because my wife says I'm yelling. Okay, so let me go to, oh, Donna, I'm not reading the chat. That's why I didn't see your multiple messages asking me if I wanted a break. So you're just gonna stop me because I'm not reading the chat. The only thing I'm reading is a Q&A. Okay, so those are the main tools that I'll use to monitor progress. Okay, so I remember the main thing that I do is the pinwheel. And so I have a before and then I have an after. You have to have these, okay? And the next thing that you need to do is videotape, which I will show you once we're done here. I'll show you a videotape. So I videotape them walking. I videotape them doing the neuro exams. And so that's what, that actually is more convincing than anything else, okay? Let's move on. So here's a couple of cases that I've done. This is thermography, okay? So this is a 51-year-old male, diabetic neuropathy, hemoglobin 5.5. So his hemoglobin actually is perfect. So but his neuropathy, his diabetes his A1C was dropped because of medication, not because of, his diet, his lifestyle changes and so forth. So even if his A1C is 5.5 with medication, he can still have diabetic neuropathy. Remember, the reason is because he's had high blood sugar for an extended amount of time. So it doesn't really matter. It could be at 140 for 10 years and you can start having nerve damage. So thermography, for those of y'all who are not familiar with thermography detects infrared heat that comes out of our bodies. So we generate that heat through our blood circulation, okay? And, sorry. We generate that heat through our blood circulation. So thermography gives us a sample, an idea of how our blood is circulating throughout our body. It doesn't tell us everything. It doesn't tell us internal organs, but it's very good for neuropathy because the areas where patients get neuropathy, those areas, the nerves are close to the surface. A lot of the nerves, like in your hands and feet, is very close to the surface, right? They're not deep inside. They don't have to go through layers of fat like your abdomen, okay? So in this one, you can see and I treated, this was a 2017 case, and I treated them for, what was that, 12, 1, 2, 3, so 4 months. You can see the difference here. So the first one, this top level, okay, right in here, you can see right here, there's a lot of inflammation in the lower back. This is the spine. So he could have had some lumbar nerve impingements from inflammation, okay? His neuropathy wasn't too severe because you can see his feet are actually decently warm. Oh, let me tell you the color scale. The color scale is green is normal, red is heat, hot, inflammation, dark blue, purple, black is cold, which is lack of blood circulation. So when it's down here, it's cold, it's lack of blood circulation, which we typically see, as you can see right here, his feet are black, purplish, and so these are typically what we see of neuropathy. Typically, severe neuropathy, we see they are all black. So that means when it's all black, it means there's no circulation, there's poor circulation. So just think about it. If their feet are not getting circulation, then of course their nerves are going to die, because if you're not getting blood flow, you're not getting oxygen. You're not getting oxygen, your nerves are going to die. So that's how he started off. This was the first time. This is before any acupuncture treatments, okay? And then 4 months later, we treated him. He still has some lower back problems over here, but you can see his feet are more green, right? Let me erase this top one so you can see his feet. So you can see, excuse me, his feet are more green compared to here, right? And look at this. Look at the bottom of his feet. He is moving up the color spectrum. It went from black to purplish, and we actually see some blue in there, right? So his neuropathy was pretty much close to 100% reversed, okay? So, but diabetic neuropathy is the easiest neuropathy to treat. It's the easiest, because once you solve the diabetes, it's like reversed, okay? So diabetic neuropathy is the easiest to read, but this is just an example, okay? All right, let me answer some questions. Dana, can nerve damage show up as hot or cold sensations post shingles? Yes. Ricardo Badilla, EMG, NCV are so subjective depending on technician. Can we see patients without tests? Yes, you can see a patient. I'm not saying you have to. They have to do an EMG or NCV before you treat them. No. That's not what I'm saying. Having the EMG and NCV is helping you establish expectations, and it's also to help you know, okay, is it realistic that I can think that I can tell the patient, oh yeah, I can reverse 90% of it. Is it really realistic? If you have a positive EMG NCV, it's not realistic. Remember, positive EMG NCV is a large fiber nerve damage. It's not realistic to say, hey, I'm going to reverse 90% of your neuropathy, okay? So this is about expectations. Does it change the way I treat? No, it does not, okay? Greg Fritz, I think FTD stands for frontotemporal dementia. If that's the case, I don't treat that many of dementia cases, so I don't know. Mario, please clarify nerve versus nerve fiber. Large and small fiber nerves are confusing. NCV done on nerve, not fiber. Yeah, the NCV is done on the nerve. So I don't necessarily differentiate between nerve and nerve fibers. I would differentiate more for large or small nerves. I think the way I communicate, nerve and nerve fiber are the exact same thing, just the diameter of the fiber of the nerve, okay? I can just use nerve if that's too confusing for you. But yeah, the NCV EMG do not detect. Fiber is like the small nerves, okay? So small fiber nerves. Okay, Tar Muhammad, Joseph. Parkinson's is central unless also has peripheral nerve involvement. Thank you for letting me know. What are your Luis Moraes? Jimmy, what's your thoughts on the 9,000 Needles documentary? I haven't watched it yet, so I can't comment it. I need to. I just haven't prioritized my time to watch TV. Joyce Sonata, I have a patient that had a nerve conduction test with inconclusive results. He thought this meant that his numbness of his feet cannot be helped. How can I explain that acupuncture can work for him? Great question. You see, the number one thing what Joyce asked is you need to know how to communicate to get the patient to start treatments. I can tell you what to do, but if they don't start treatments because of your lack of communication, it ain't going to help. Great question. So they have an inconclusive nerve conduction. So Joyce, what I would tell them is this: nerve conduction only tests for large nerves. Okay, it only tests if your large nerves are damaged. It does not tell you if their small nerves are damaged. The fact that if you have numbness means your small nerves are already damaged, and we can help you with that, regardless of what the nerve conduction test, the EMG, tells us. The only reason I like the EMG is it tells me, okay, how much can I help you, right? That's the benefit of those conduction. So the fact that it's inconclusive is a great sign. It's a great sign because they're not sure, a couple of neurologists, radiologists, they're not sure if you really do have large nerve damage, which is awesome. Because if you don't have large nerve damage, then acupuncture can work great. That's how I would communicate. Dr. Anjali, what about age-related nerve weakness in the legs with no other associated disorders? I think it can work. Okay, I need to move on, okay, because we need to go over some more stuff. Oh, this is the one that I was telling you early on. He was actually 80-year-olds, not 82. So he had lung cancer. So he was the one in 2013. He had whole body neuropathy. So it was all over his face, all over his arms, legs, chest, everywhere. It was everywhere, right? And which was the first case I've ever seen. And so this, remember, black down here is freezing cold. Purple is lack of blood circulation. So green is normal. That's where we want to get. So this is, I'm only showing pictures of his lower body. Okay, I took pictures of his whole body. But you can see all of this, coldness, not very a lot of green. And after 2 months, the neuropathy, his neuropathy localized to his ankles and feet. Okay, so his whole body neuropathy, his face, his arms, his hands, his body, his chest, all of it went away, and it just became just his feet, his legs. Okay, so this is not like a drastic night and day difference, because he was the one, he came to me 1 year, not 2 years. See, he came to me he had it in 2013. He came to me in 1 year, almost 2 years, a year and a half later, right? It's been going on for at least a year. And then he came to me. So that's why the difference between these two is not drastic. It's harder. The longer you wait, the longer it takes. But you can see, look at all this green that's coming back. Look at all this green. That's the reason why it localized to his feet. Okay. And you can see, look at all this green here, green here. You can see there's less purplish here, less purplish here, less purplish here compared to here, less pink, right? So this shows that there's blood. His brain is actively moving blood to his legs, and it's holding, right? So that's what I'm telling you. I have these objective data. I have, functional data, video to show that my patients are improving. This is not just, I do this mainly for the patients, but you get the benefit of seeing it, okay? All right, I'm gonna go over this last one and then I'll answer some more questions, okay? Y'all are asking great questions and I definitely wanna answer it, but I do need to speed up some. All right, this one's a 56-year-old female complaining of tingling, burning in feet. This is idiopathic peripheral neuropathy. So they don't know what the hell caused it, right? So this was in 2015. The tingling and burning was 8 out of 10, so very bothersome. And we did 6 months later. The tingling burning is cut in half. And look at the circulation. See, green is where we want to be. So look at the blood circulation. It's more green down here, less dark blue, less purplish here. There's a little more blue. This one looks about the same. These look about the same. So her neuropathy was not eliminated 100%, but she was able to regain function. Okay. Next one, 26-year-old female with numbness down legs. Now this was caused by a lumbar. So someone was asking about lumbar, if you have a lumbar problem, right? Structural problem. So this patient has structural problem, lumbar radiculopathy. So over periods of time, you have nerve damage, right? So this was a 2015. So she had pain also. Okay, lumbar radiculopathy, she had pain in her back as well as numbness in her feet. And you can see the inflammation in her lower back. And then you can see how dark her feet were, the bottom of her feet, and how dark her calves were. And after 3 months, her pain went from an 8 out of 10 to 2 out of 10, okay? So when I say, they went down from 8 out of 10 and 2 out of 10, I'm not talking about, the pain went down 2 out of 10 and then the next day it went back to 8 out of 10. Okay, so when I list these visual analog scale, the pain scale, this is consistent. Her pain is consistently 2 out of 10. Because with my QRA acupuncture, for pain, I eliminate pain in 10 seconds every time. It's just a matter of, making it stick. That's the key. So after 3 months, we made it stick from 8 out of 10 to 2 out of 10, okay? Small reduction in her lower back inflammation, but still it was enough where it alleviated the pain, right? And it was enough where it stopped causing the neuropathy so bad. Because we can see now purplish and blue in the bottom of her foot versus up here, it was dark and black. So just by reducing a little inflammation from the top, from the source of the problem, this is the result that happens, right? Look at our calves. We can see blue, light blue, green coming in just from reducing this. Not by a lot, but just a little of that. So you see, when you find the root cause, see, this is what I was talking about very early in the beginning this morning. You got to find the cause. You got to find the thinking process, the process of making a decision. Where do you treat, right? You treat the root. So this person, the root was in the lower back. Okay. All right. Let me answer some questions. Okay. Do you think E-stim is better treatment modality for neuropathy? Sung Young Kim, no, it's not. I rarely use E-stim in my practice. If you use my QRA, you don't need E-stim. Probably, I use E-stim 1% of the time. I still use E-stim, but probably 1% of the time. What is the medication that helps with neuropathy again? It's Neurontin or gabapentin. By helping, do you mean numbs the pain? Cynthia Wallace. No, I don't mean numbing the pain. I mean eliminating the pain, decreasing the pain, making the pain stay low. Okay? Making the pain stay, the intensity of the pain stay minimal. So this patient had structural problems. See, she has lumbar radiculopathy. There's structural problems that's pressing on her. I can't fix that. That's why she will always have some inflammation in her lower back. But what I did was I retrained her brain to keep this inflammation low so that it doesn't bother her, okay? Again, I'm not talking about just 1 or 2 days of 2 out of 10. I'm talking about consistently every day, okay? All right, Christina Lee, nice. Utilize, abuse Dr. Google. It's for free. Okay, y'all should all be using it. I don't know why y'all don't use it. I trust Dr. Google more. I mean, for some stuff, okay? Are you concerned with mask wearing by the general public and possible oxygen deprivation that may occur over time right now? Inspire life. Yes, I am. Jeanette Morris, I've seen oxygen supplements. Is that possible to supplement to benefit nerves? Oxygen supplements? Oh, I've never seen that. That's pretty cool. Let me know. Email me, let me know what that is. Your pencil might be out of juice. It is? Oh, this might be earlier on. Does Neurontin actually help nerves regenerate or just numb the pain? Cynthia Wallace, great question. Gabapentin or Neurontin only numbs the pain. It's a mask. It's a Band-Aid. It doesn't do anything. There is nothing medically that regenerates nerves. Nothing. Lucienne Lalaman, can you also write the character of Chi on that slide for comparison, please? I'll write it really quick. This is Chi. This is energy. Okay. Will a simple oximeter show the lack of oxygen in the patient's body? Great question. I have an oximeter, a pulse oximeter. It doesn't always, but you could. Yeah, I would definitely. Oh, that's why y'all are saying my pen is out of juice. Sorry. Let me stop share and then share again. It's I don't think it's the pen because it's 83% charged. It's the screen mirroring. Sorry, guys. Technology is great until it stops working. There you go. Now you can see it. Okay. Let's go on the treatment protocol, and I'll go back to answering questions. Okay. Let me go through this quick. So here's what some people were asking. How do you determine, what's my treatment protocol? How do you determine if it's going to work for them or not? We have a definitive way to know if acupuncture is going to help them or not. And we will know it within 3 to 6 treatments. We do not wait till 3 months later down the road of treating them and say, oh shit, it doesn't work. Okay. I think that's not ethical. So here's my way. Non-numbness neuropathy, okay? Non-numbness neuropathy, you got the pain, burning, tingling. These are easier to treat. The rate of response is 3 to 6 treatments to know if you can help them. So my rate of response is, let me get a drink of water. My rate of response treatment means my step 1, okay, I'm going to erase the Chinese characters, okay, because I need more space. Well, actually, I can do this. This is step 1. Hey, where's my pen? There we go. Step 1, initial exam. So I do my initial exam, and I do the neuro exams. I do the pinwheel. I do my thermography. I do my pulse. I do my Q&A, my consultation in my exam. That's all step 1. And then in step 1, then I determine step 2. I tell the patient, we're going to do what I call my rate of response test. Okay, I call it ROR. So the purpose of this is what I tell the patient is, okay, since I've never treated, so here's a little freebie for you, okay? I highly recommend you write this down. I am about to say my secret script of how I close patients. You ready? Here we go. So I'll use, who am I going to pick? Lena. I'll just use Lena as a name. Lena, now acupuncture works phenomenal for neuropathy. However, will it work for you? I have no idea because I've never treated you before. So what I need to do is test your body to see if acupuncture will work. And the way we test your body is we're going to start off with 3 acupuncture treatments. And these 3 treatments, I want to see some improvement in your neuropathy. Whether it's your burning, your pain, your tingling, or numbness. And I also want to see improvement in some of your daily functions. So I need your feedback to let me know. Now, if you see 0 improvement in your symptoms or your function after these 3 treatments, then acupuncture will not work for you and we will stop right there. But if you do see improvement, then acupuncture is going to work for you, okay? Then the second question I need to know is how fast or how slow is it going to work for your body? That's what I call your rate of response to acupuncture. And how do we determine that? That is based on how fast you see those improvements in your symptoms and also your function. So the faster you improve, the faster you feel some relief, you're considered a fast responder. The slower you see those symptoms improve, you're considered a slow responder. Now, why do we need to know that? We need to know that because if you're a fast responder, you require less treatments, less time, less investment. If you're a slow responder, it's the exact opposite. It's common sense, right? Now, I need you to do those 3 treatments all within 1 week, all within 7 days, in order for me to get an accurate assessment. Is that going to be a problem? Okay, I know some of y'all can't write that fast, so you'll have the recording to this, the playback to this recording, so you can come back and listen to it, and you can write out that script, okay? So I'm not going to say that again. I'm not going to say the script again because I need to move on. But that is my exact script, and whether it is 3 treatments or, like I said, 6 treatments right here, if it's 6 treatments, I would just say, I need you to do those 6 treatments within 2 weeks. So 3 treatments per week for 2 weeks, okay? So that's how I communicate. And I would say when I do that, 99% of the patients continue, okay? So what am I looking for? I'm improvement noticeable by the patient. Like I said, the symptoms, right? Function. You monitor subjective and objective. So, the ones that have numbness, I would do on the 6th treatment, I would do the pinwheel again. I would do the pinwheel, and then I would also do some of the neuro exams. Okay, and I'm going to show you the neuro exams. So hold on to your piece. I will show you the neuro exams. I'm just going to go through this first, and then once I know that it works for them, then we start monthly treatments, monthly treatment plans. Okay, but it takes in these conditions for non-numbness neuropathy, it usually takes about 3 months to reach potential peak benefits, like sustained results. I'm not talking about relief, okay? I do not operate a relief clinic. A relief clinic is the patient gets relief and then you say, oh, they're good to go, and you discharge them. I don't do that. I'm not saying it's right or wrong. I have a corrective clinic. So what that means is after I get them the relief, I want to make sure that their body is retrained so that it will keep that relief minimal. It will hold that relief, okay? So that's what my treatments do, okay? So that's for non-numbness neuropathy, okay? Let me answer some questions because people might have questions about this. I know I'm a little delayed on the questions, so I'll try to brush through them really quick. What about restless leg syndrome? We will be talking about that tomorrow. Type 1 diabetes, Nikita, I don't know if it's reversible. How soon can you treat a spinal injury? Alexis Starnes, how soon can you treat it after a spinal injury? ASAP. Thoracic outlet syndrome, Jeanette Morris, very good. It works, my QRA works great. MRI of contrast has many side effects. Simon, possibly, yes, very true. But an MRI imaging, knowing what the structural problem is, gives us more data, right? Do we need to have it in order to treat them? No. But does it help us communicate with the patients? Yes. Owner, what would it be the root cause of tingling, burning sensation around ankle or up to half or calf? Owner, I have no idea. It could be all of the above reasons. Do you use acupuncture to help rule out structural problem, or always refer to neurologists for confirmation? Great question, Nancy Gallen. Yes, sometimes I use acupuncture to rule out structural problems, because if I can't use acupuncture to help my patients, there is a structural problem. So if they haven't gone to a physician, I know some of y'all are like, I don't want to refer out, or I can't refer out. It's okay, treat them. And if acupuncture doesn't work, then there's something structurally going on. Refer them out. I'm now seeing your comment, Donna. Do you ask patients to get their blood tests in order to do organ dysfunction diagnosis? Owner, nope. I asked them to get their blood tests, but I do it based on my functional pulse diagnosis. When do you re-exam? Yeah, I do re-exams once a month. Do you just have your doctors send results to you, or the actual scan images? Deborah Farback. I just have the report. I don't look at the MRI unless they bring it to me. But I ask them for the report. Can you use a 7-star needle for nerve testing? Yes, you can. By re-exam, do you mean at each follow-up visit? Anonymous attendee. No, that's not what I meant. Re-exam is what I just said. Whatever I do in the initial exam, all my testings and stuff, all my questioning, I do the exact same thing in my re-exam. Okay. How often do you re-evaluate? I already answered that question. Sometimes I'll have a patient with numbness, peripheral neuropathy, whose feet are warm. Yes, they're not always. Oh, great question, Elizabeth Saylor. So you may feel that their feet are warm, and I may too, but when I do the scan, they're still cold. The thermography scan, they're still cold. And if you don't have a thermography scan, I understand. Jimmy Chang did something that was pretty brilliant. Since now we're all doing the temperature checks, right? You can use those infrared temperature checks, those infrared guns. Get one of those and just gun their feet, and then gun somewhere else, their core body, right? And then, okay, I said that wrong. Don't gun their feet. Check the temperature of their feet. Okay. I don't want to get sued, or someone say, hey, I shot one of my patients just like what you said. I was like, no. Okay. So use one of those take the temperature of their feet, those infrared temperature. Okay. How can you use very sensitive pore circulation? How long does a thermograph take to change? Anjali, great question. The thermography, it could change instantly. Like I've done it where I had a patient, I had the patient sit in front of the camera, and then I stuck needles while the patient's sitting in front of the camera, and you can literally see like inflammation start to decrease. I mean, it is pretty cool. It's pretty cool. I don't do that with all the patients though, but that's only instant change, right? And then after you remove the needles, a lot of times they'll come back, right? And so that's why I do it once a month, because I want to know like sustained results. Do you use bleeding techniques for neuropathy? Nope, I don't do bleeding. I've done it in the past, too messy, not enough. And so what I look for is efficient. How can I get the results in the quickest, shortest amount of time for the patient and for me also, right? But mainly for the patient. And I've done bleeding before. It takes too much time, and the results are slow compared to just needling. What thermographic scanner would you recommend? What do you use? Daniel Metzer. I use one from MedHot, but I don't recommend any of y'all buying it because it's freaking expensive. It cost me 40 G's, 40 Benjamins to buy that. Okay, so I don't recommend. Remember, before I had it, I was still treating neuropathy. Okay, go by function. Kimberly Curtis, what is your success with treating nerve pain from shingles? Oh, almost 100%. Almost 100% is phenomenal. Cesar Torres. Hey, I know another Cesar Torres. Patient has idiopathic numbness in the feet for 5 years and starts to have a shooting electric pulse in the hands. Is he improving at his feet and starting neuropathy in his hands? In 5 years and started shooting electric pulse. I would need more data to know about that. Okay, let me move on. All right, so we talked about numbness neuropathy. Okay, what about people who have numbness? Non-numbness neuropathy, and now numbness neuropathy. Remember, numbness neuropathy is harder to treat, okay? It's more difficult to treat. Rate of response, 6 to 12 treatments. So let me go back to this. So for those of y'all who are new to neuropathy, I recommend you always start off with 6. I can do 3 because I've treated, hundreds of cases of neuropathy, right? But I recommend you start off with 6 treatments, 3 treatments per week, 2 weeks. Numbness neuropathy, you might even start off with 12 treatments, okay? So that's 3 treatments per week for 4 weeks. And the improvement is not as drastic for the patient. That's why you have to monitor objective tests and more function. And I'm gonna show you. Function, you wanna monitor function, okay, like walking. The monthly treatment plan is 3 to 6 months to reach potential peak benefits, okay? Let me see if I can catch up with, there's tons of questions. I don't think I really catch up with questions. Okay. So this is the treatment protocol, all right? So the tools I use are acupuncture, herbs, dietary lifestyle change, supplements, and other modalities, okay? Acupuncture. Guess what? What did I say in the very beginning, right? No magical points. No. Don't be asking me what points. Can this point work? Can this point work for neuropathy? Here's my answer. So don't ask me in the chat, in the Q&A box. Can I use this point? Here's my answer to every one of those questions. Yes, you can use every point. Every point works, okay? So my QRA is imaging. But before I go into the acupuncture, let me do the neuro exams, okay? So I think some of y'all might be interested in that. So let me see. Okay, let's first do Romberg's. Let me go back to here. Romberg's. Okay, Romberg's. Get my camera. So what you're going to do is you're going to have the patient stand. Let me see if we can get my, oh, you can't get my feet. Let me try something. Let me see if I can get my iPad to do it, okay? Let me see if this will work. Okay. So you want to get the feet, let me wait till it sinks. You want to get the feet together, okay? Have them stand together, and you might want to have them, stand near a desk where they can hold themselves or have their cane, okay? So you want let's come here. Okay, so you want them to have their feet together, okay? And you may need to be there to assist them because they're going to be all wobbly, okay? Let me wait till the video comes back. The video is lagging a little. Okay, so they may be a little wobbly, so you want to make sure you have some type of support where they can hold on before they let go, because they're going to have to let go, okay? So when they let go, I'm going to move the screen up now. So when they let go, their feet are together, okay? And then you're going to have them move. So their feet are together. You're going to have them move, and they can have their arms out because it's easier for them to balance with their arms out. And you're going to have them stand like this, okay? You're going to have them stand like this, and then you're going to have them close their eyes. They're going to look straight, and you're going to close your eyes. And people with neuropathy, what you're going to see is they're going to be flying like an airplane, okay? Not intentionally, but they're going to be flying like an airplane, all right? And why is that? Because, let me come back to this. Let me show. Okay. All right, so, oh, this is like computer super lag. All right, let me restart this. Sorry, guys, this technical. Let me just stay here. So when you have them stand with their feet together and you have them close their eyes, they're going to be wobbling like this. They're going to be flying like an airplane because what we're testing is the nerves in the bottom of their feet. So the nerves in the bottom of your feet, the nerves in the bottom of your feet help you sense balance, sense where you are, where your brain, where your whole body is, right? So messages from the nerves in the bottom of your feet will send messages to your brain to tell your brain, hey, I am standing here, right here, okay? So that helps us see if the nerves in the bottom of the feet are sending that message. So if they're like flying like an airplane, okay, then that means the nerves in the bottom of their feet are dead, right? Did I just confuse everybody? Okay. Can you type into the chat, did I just confuse y'all? Did I make sense? Did that make sense? It didn't make sense? No? Okay, awesome. So that's just a simple test. It's called the Romberg's test, okay? You just have them put their feet together and then close their eyes and see if they fly like an airplane. All right, next. So the next one is called it's called a tandem gait, or I call it the drunk walk, right? Has anybody done the drunk walk before? Okay. Has anybody been pulled by the cops and had to do the drunk walk? Kimberly Curtis, you had to do that? So the drunk walk, I'll use my Mac to see if, well, I'll just use my hands. Okay. So the drunk walk is basically walking. Let's be professional. Let's get it done. Hold on. Let me maneuver some stuff around. Okay. Here. Let's get. All right. I'm going to spin me around. Okay. So the drunk walk or the tandem gait exam is basically heel to toe. So they're going like this and they're balancing, okay? Go back here. So they're going like this, have them do this. So people with neuropathy, again, you will see them fly like this, like an airplane, like they're drunk, okay? They will lose the sense of balance. So I have them do it forward, and then I have them do them backwards. See? So they'll be going like this, okay? And then I have them do heel walk, okay? And then I have them do toe walk, okay? So heel walk, they will go slow, they'll be like that, and they'll be toe walk, right? Like this, toes. Okay, did that make sense? Thank you. I like my shoes too. Okay. Do I need to show it again? No? Okay, good. Let me come back. Okay. All right. So you see, that's all the neuro exams I do. Very simple, okay? Are they doing it with shoes or without shoes? Either one. Just have them consistently do one or the other, okay? It doesn't really matter because you don't want them to fall. So whatever they are comfortable with whatever they are comfortable with, then you just do that. Okay. All right. So those are the exams that I do. Very simple. Like I said, there's so many other neuro exams. I mean, you can get. Remember, remember the questions that I asked. Is it going to change your treatment process? Is it going to change your treatment? If it's not, there's no point in doing it. Okay. All of these ortho exams, neuro exams, it doesn't change. Maybe it changes your treatment. It doesn't change my treatment. So I don't waste time doing it. Okay. And at the end of the day, here's the thing. You can do all the neuro exams, ortho exams, all you want, and you can show improvement in that. And you can show the patient that they're improving in your neuro exams and ortho exams. But if they don't see improvement in their quality of life, does it really matter to them? No, it doesn't. Okay? It does not. So
Jimmy,
that's what I'm saying. Stop doing all of these, I think it's useless. I mean, unless your treatment depends upon it. But today we're talking about my treatments. My treatments do not depend upon it. Okay? All right. And,
Jimmy, can we go ahead and take a break?
When are we doing lunch?
At the next hour.
The next hour? Okay, so can we do a short one?
Yeah, we can do 5 minutes.
Let's do 5 minutes. So it's what? 12:02. So let's go 12:07.
Okay.
12:07, guys. 12:07.